Good afternoon, everyone. Welcome to today's town hall. We'll get started in just a minute. I'm going to leave a couple of minutes to get as many people in and logged on as possible. We'll just give it a minute to make sure that happens. Thanks for everyone that could make time today in your busy schedule to take a little moment from the work you're doing to take part in today's town hall. I know it's not easy to do, and we'll do a little housekeeping in just a minute before we kick things off formally. We have a good agenda today with lots of important work underway. Okay, there we go. So we're getting up to just over 100. We'll kick things off formally. Good afternoon, everyone. I'm Aaron Levo, the Vice President of People, Culture, and Communications here at Hamilton Health Sciences. Happy to be playing a moderating role for today's town hall. Just a little housekeeping before we kick off our formal agenda. A reminder that we have our Q&A function open today. So you can type questions into the Q&A function, and our panelists and subject matter experts will respond as best they can. You can also review the answers they've provided under the Answered tab in the Q&A function. We'll do our best, everyone, please, to reserve the Q&A function for questions, and we'll save the chat function for celebrations. And at the end of our presentations today, we'll stop and have a moment to celebrate some of the good work that's going on, some of our accomplishments. So please think of that as we go. If you have something or someone that you'd like to celebrate, when we get to the end of our agenda, you'll have a moment to either type it in the chat forum or you can raise your hand and we'll call on you to give your celebration or shout out live. So Q&A is for questions, chat is for celebrations. We have a packed agenda today with some really wonderful presentations. To kick things off, Rob McIsaac was double booked today and couldn't be with us, but very pleased to have Sharon Pearson playing the lead role for today for our town hall. So Sharon, I'll pass it over to you.
Great. Thanks, Aaron, and good morning, everyone. Happy to be here on behalf of Rob. As usual, we'll start with our traditional land acknowledgement. We are privileged to provide care on the lands that Indigenous people have called home for thousands of years. We recognize and respect the presence and stewardship of all Indigenous peoples as keepers of this land. I have three special observances that are coming up in the month of November that I'm going to talk about in my opening remarks today, and also a little bit about the My Voice Matters. But before we cover today's agenda and move through the next hour or so, I would just like to comment on the horrific and unfathomable tragedies that are unfolding in our world today. And I know that so many of our staff, our physicians, our learners, our patients and families and volunteers are directly or indirectly related to those that are experiencing these events. And across HHS, we know that we have staff, physicians, everyone comes from different backgrounds, cultures, traditions, religions, and beliefs. And the events that are unfolding have the potential to really amplify the differences among us. But they also have the ability to bring us all together, and really is a true reminder of the importance of unity and compassion and understanding as we face real adversity in the world today. And I'd be remiss if I didn't underscore today the importance of the values at HHS, the caring and the respect, and of course, the innate compassion that everyone brings to work every day. And it's so important that we create an environment that is safe and supportive and inclusive for everyone who walks across the doors and into one of our sites and centers of HHS. And I know many out there are struggling. Many of our colleagues are patients and their families. So I ask that we all support and we act in unity through this time. I would also ask and remind you to seek support as you might want to do so. We have employee and family assistance programs. Those programs are available to anyone and everyone 7 days a week, 24 hours a day. They're immediate, they're confidential, and please take advantage of these resources. There's details certainly from your leaders, but of course on the hub. So with that, for today's agenda, I will do my usual operational update. We'll hear from Dr. Mertz. We'll hear from Deb Bedini with the scheduling on Kronos renewal, and McMaster about the growing services of McMaster Children's Hospital. But before we move on to my operational update, just a few comments that I mentioned. One is the My Voice Matters staff and physicians survey. So it is open now, and it is open till November 20th. And we've certainly seen some early traction and many people are responding, but it is your opportunity to share with us your experiences, either working at HHS, practicing, or training across our many sites and services. There's some incentive there. There's a free coffee beverage that you can redeem at the cafes. We're also doing some individual and team prizes as well for those who participate. Most important, though, it is imperative that we have staff's input and feedback, and we really value what you provide to us in these surveys. So I would encourage you to take the time to complete the survey. I'd also like to talk about 3 upcoming observances in November. So first is, of course, Remembrance Day on November 11th, and so important that we all pause and reflect on the individuals who have served or are serving in our military across our nation today. Certainly encourage everyone to acknowledge our services on November 11th, when we take the moment of silence. We do have some other details that we will circulate closer to the observation day. Also, later on in the month, November 20th, is Transgender Day of Remembrance. This is an annual observance that honors the memory of transgender people whose lives have been lost in acts of violence. And certainly we have seen those violence events certainly relayed to us through the media. It's really important for each of us to reflect on how we can help elevate the voices of transgender people in our communities, in our workplaces, and actively work to eliminate the discrimination and barriers they face. So please mark that day as well on your calendars. And then also at the very end of November, November 25th, is the International Day for the Elimination of Violence Against Women. Women around the world are subject to violence and insecurity every day, and women in this community, in our community, are not removed from this reality. And certainly we all have an obligation to speak up if we observe or are aware of this. We would ask that if you are a victim, a victim of discrimination or violence or any abuse, certainly we have resources. There's resources on the hub, and certainly available from your leaders as well. So really important days in the month of November for us to take time and to pause. So with that, I will launch right into my operational update. So if we could go to the next slide. And as usual, I'll start with the COVID numbers and where we were at. So if we could just advance one more slide. There we go. So as of today, we have 77 COVID patients. We did peak a little bit higher than that through the month of October, but we have declined and settled in this sort of 70 to 80 range for COVID patients. 5 currently in the ICU. Right now, only 1 active outbreak. Next slide, please. In terms of our occupancy, we certainly have been stressed and pressured for capacity across all of the sites over the 4 weeks, certainly through October. You can see our aggregate occupancy rate with an adult 108%. ICU has been running a little bit lower in occupancy rate, but very pressured from a staffing perspective. And all of our acute sites, as I mentioned, with certainly the Juravinski as always having the highest capacity. McMaster Children's also, just as all the children's hospital, are experiencing some pressures this season again. So you can see McMaster Children's at 93%. Next slide, please. In terms of some of the other specifics around capacity, from an ED perspective, our volumes, I've been reporting for months that they have been stable, but we are starting to see a few more patients with the settling in of the flu season. So about 10% more patients through the JHED with a slightly higher admit rate, and the clinicians would certainly indicate that that's related to acuity. The general, not quite as high in terms of the volumes, but certainly also seeing a higher admission rate at the Hamilton General as well. And then for the McMaster Emergency Department, you can see very busy ED there, upwards of 160 patients a day. While it is a little bit lower than the inordinate surge that we had last year, it's certainly on the rise as we're in, again, this flu season. The next slide, please. In terms of other pressures, we do continue to have pressures across the pediatric and the neonatal population. This is not new. They're certainly very intense, both in the PICU and in the NICU. From an ALC perspective, it continues to increase. So you can see a 9% increase in October compared to September. Again, we continue to have challenges with access to post-acute care as they too are faced with health, human resource, and capacity challenges. Our outbreaks, while we have one right now, we have peaked up to 5 and 6. So we fluctuate in terms of those numbers and the impact that they have on the capacity across our sites. And then, of course, as our patients and staff are sick, so are our staff and physicians at times. Next slide, please. In terms of what we're doing, as always, optimizing our post-acute capacity across the satellite health facility, St. Peter's, and of course, the other community agencies that we partner with for post-acute beds. Lots of work with home and community care services to make sure that we are implementing all the admission avoidance, visit avoidance strategies for our ED departments. We have been redirecting our non-regional critical care patients from the Hamilton General site in order to preserve that capacity for the level 3 regional programs that we support. And that will be in place for several more weeks. We are also maximizing any of the same day home overnight surgical opportunities that we have and have been doing so for quite some time. We have had to defer and cancel some scheduled care because of the inordinate capacity pressures on some days. We continue to maximize our remote and virtual care options, and certainly lots of conversation across both the adult and the pediatric tables with regards to both H&HBB planning, but also West and Ontario Health planning as well. Lots of work continues with our workforce planning. And I know I've updated, as have Aaron and Les Gillies updated on the strategies that are in play. And certainly as we are in this flu season, lots of community education and certainly updates to the media on the importance of getting COVID and flu vaccinations, which I know many of you have done. And certainly our patients are participating as well. So that's my update today. I would like to extend a genuine thanks. I know the pressures continue to be substantive across all of our sites, both from a volume perspective, but also from a staff perspective. So I do thank you for everything that you're doing every day. And with that, I'll pass it back to Aaron.
Okay. Yes, thanks very much, Sharon, for that. Lots of content there, and for the thanks to the workforce. Next up on our agenda, we have an update coming from Dr. Dominic Mertz, who's our Medical Director of Infection Prevention and Control, to talk a little bit about local and broader epidemiology and viral season. Dominic, over to you.
Yeah, thanks, Aaron. And I think as an introduction, things look much more normal this year when you compare about what happened last year, and Sharon already touched on that. Next slide. So I will quickly go through the activity of multiple respiratory viruses, touch on the impact on our healthcare system, and mention one latest policy change that we implemented this week. So COVID positive patients, that this is across H&HB, and as Sharon already mentioned, we had been declining over the last few weeks. So this is the H&HB picture, and you see it looks like we had the first peak last year around this time of the year. We were just at our second peak when we look at total of hospital admissions. We had that like late summer, early fall peak, which didn't materialize this year. Next slide. This is the Hamilton specific picture. And again, you see that decline that was mentioned, not as significantly as when you were looking at the entire region of H&H, but still lower than we've been last year at the same time. Numbers of outbreak, and that's the provincial view here. You see lots of colors. What you should focus on is orange, which are the hospital, and this is only COVID still. So for now, focusing on COVID, We did see some increase certainly over the last few weeks compared to the summer period. We are doing better than last year around the same season when it comes to COVID outbreaks in acute care, but also in long-term care, which is red, and those other complicated settings, which are in different other colors listed here. Next slide. So how do those other COVID metrics look like within the city before we move to the other respiratory viruses? Wastewater here on top, fluctuating a lot, similar range, I would say, as last year around the same time. But again, it looked like we had a peak a couple of weeks ago that seems to be coming down at this point. Next slide. Then looking at death, hospital admissions, and ICU admissions of those are only Hamiltonians. So this may certainly be different from what we see on the ground in a hospital, because we not only admit Hamiltonians, obviously, but this is within the catchment of Hamilton Public Health. And you would see that we did see an increase in COVID deaths over the last few weeks, more blue bars there on the very right-hand side. And again, I highlighted in yellow the same time period last year. Still looking better than last year, but again, certainly an increase compared to what we saw over summer. Hospitalized cases in the middle, again, increase, but lower than last year around the same time. And ICU admissions the same at the very bottom, with, according to this data, no new admissions of Hamiltonians in the last 7 days. Next slide. Now broadening the scope to any respiratory infections, and this is data for ED visits. And you certainly see that increase, in particular in the pediatric population, 0 to 4 on the left upper corner and 5 to 17 below that. Lower than last year around the same time, but certainly picking up compared to what we typically see during the summer periods. Not as much change yet in the adult population, with a little bit of a first peak that we've seen in the 65 plus couple weeks ago. Next slide. Now, this is our HRLMP report, which tells you which viruses are the most common ones at this point of time. And as you probably have noticed, flu season hasn't started yet. Flu A and B, we only see very sporadically. We do see cases, but we don't see an increase yet. Little bit of human metapneumovirus and paraflu and adenovirus, which isn't unusual for this period of time, but most certainly, and that's probably the most important piece, we see RSV, respiratory syncytial virus, increasing. 68 cases were reported last week. Rhinoenterovirus is on the decline. We peaked shortly after the last town hall, so roughly 3 weeks ago, 130 cases, COVID 197. COVID we mostly see in the adult population. RSV and rhinoentero are the most common ones in our pediatric population. Next slide. And this translates into the patient days of patients with respiratory viruses at the Children's Hospital. You see that black line on top, which is the total number of beds occupied by patients with respiratory infections. This is mostly driven and has for now peaked last week, because we had a combination of still a lot of rhinoenterovirus plus RSV picking up. Now that RSV seems to be consistently declining and RSV looking a little bit better as well. It had dropped, but we expect that RSV curve to go up and then again pushing up the bed occupancy for respiratory viruses in general again going into November. And you see that background activity of typically somewhere between 1 and 2 patients with COVID at the Children's Hospital. Next slide. Maybe at in terms of flu in particular, or activity of respiratory viruses more general. This is how the map in the US looked like last year around the same time, well, ending October 22nd, so close to where we currently are. And you see a lot of red, and that was the combination of flu already circulating, then RSV, COVID, and all the other viruses. On the next slide, you see the current map in the US. And as I mentioned a month ago, typically we see that sort of wave coming up from the south, and that's why I'm sharing this here. So next slide, please. That's this year, still a lot of green, some yellow. So we are lagging behind compared to last year, which means it looks like a more normal year in terms of when those viruses gain activity or get more active in our region. Last year, we were very early. This year, it looks like things will only get started. And as I mentioned, flu is still sporadic at this point. We certainly expect it to go up within the next month or two, which, side note, means that we are still in perfect shape to get our flu vaccines at this point of time. Next slide. So in summary, COVID activity and impact on healthcare is currently stable to declining after an increase throughout September, and we are at a significant lower level than we've been a year ago. Rhinoenterovirus has peaked, RSV is now picking up, and influenza is still sporadic. And then we have some background activities of the other respiratory viruses. The US data suggests that we will not peak as early as we did last year. So a more normal year from that perspective is what we are expecting at this point of time. The one policy change I wanted to share with you is that our routine approach to known COVID exposed patients, either because they live with COVID positive individuals at home or were roommate exposures, had been to isolate them for 10 days and test them on day one. So as soon as we know they've been exposed, and 5 days after the last exposure. The policy change is that now, once we have that negative test on day 5 or later after the last exposure, and this test is negative, that we will take them out of additional precautions because we typically don't see them becoming positive after a negative day 5 test. So no longer mandatory 10 days isolation in healthcare for those folks as long as we have a negative test. That's it for my end, and happy to hand back to Aaron.
Yeah, thanks very much, Dr. Mertz. Very informative update as always. Next on our agenda, we're going to learn a little bit more about the work underway to renew our scheduling system, which our Kronos system. And to do that, we have Deb Bedini, who's our VP of Adult Regional Care, and also an executive lead for this project. So Deb, over to you.
Thank you, Aaron. Good morning, everyone. Michelle Leafleur and I are co-leading this project, and I'm presenting on behalf of her and the Scheduling and Kronos Renewal project team. Next slide, please. This guiding principles we start every meeting with, every discussion we have is built around the guiding principles that were developed based on feedback we heard from our staff. You will see our ultimate goal is optimal scheduling functions for everyone. And our guiding principles include engagement and inclusivity of all of our staff and all members that would be involved in scheduling, continuous improvement and removal of waste, enterprise-wide approach, follow legislative and regulatory requirements, and supporting people through change. Next slide, please. So how did we know there was an opportunity existing for our scheduling and Kronos? We know our workforce and their needs have changed. There's options, staff have options to get work at different places with different scheduling options that work for them. We need the ability for flexibility of scheduling practices and the impact it has on work-life balance. And leaders and schedulers are spending more time on scheduling in the context of the current HHR shortages, which we're all familiar with. We also know technology has changed, and our current version of Kronos will reach end of life December 31st, 2025. Scheduling is more complex. Role and skill requirements that are involved in scheduling must be reviewed. We need to have improvement standardization to support fairness, efficiency, and data accuracy. And the current scheduling processes and systems result in waste and rework. Next slide. So we had over 1,500 comments come from staff who gave insightful feedback through survey responses, including My Voice Matters, interviews, CQI opportunities, and other valuable internal sources. So what we heard was people wanted confidence in the system. They wanted accuracy and optimization, modern workflows that meet the needs of them. So being able to access or schedule real time on a device or a method that works best for them, standardization, and better user experience. Next slide. So today we're working on 3 work streams, and I'll just do a high level of them. So there's a process and schedule work stream, and it's really looking at pain points and opportunity for improvement corporately. Some of you may know, we've already started the posted schedule duration extension. So we've taken it out to 8 to 10 weeks for most of the areas, and we're in the process of expanding that to everyone within the organization. We're working on prior pay period adjustments to make that smoother and work better and be more efficient for our frontline staff, and also a more efficient vacation request process. For our scheduling structure work stream, we're reviewing the current scheduling structures, roles, and responsibilities to ensure we have an optimal approach. We want to ensure that everyone has the tools and resources to carry out their roles. So the key activities we're working on right now is looking at current state, the roles and descriptions, internal stakeholder engagement of people that are involved with the scheduling and also the people using the scheduling, and a best practice review. Our third work stream is enabling solutions, and this is the procurement and implementation of a scheduling and timekeeping solution. So currently we're in the procurement process to select a new scheduling system, and we're hoping that should be identified within the next month or so. And our system targeted go live is the summer of 2025, sorry. And you will, once we landed the vendor, people will start to see what the new system is, and then the engagement with that on how we're going to roll it out. Next slide. So to summarize really our timelines, right now we're in the summer fall. We've identified and are making improvements to our scheduling process. We've announced the vendor. We're going to be announcing the vendor shortly. In early 2024, we're going to continue to identify and make improvements to our scheduling process. And what I want to point out here is that we are not waiting for the new system to come in to make improvements to scheduling based on the feedback we've heard from our staff. We intend to continue to move along and make those improvements as we bring in the new system. We're going to be doing the project planning begins for the new system of how we implement it and bring it, educate and bring it into HHS. And then we're going to do an end-to-end scheduling process review and re-engineering of the entire process. Again, that will have feedback from our frontline staff and people who use the system. And our go live is the summer of 2025, where we have the new system replacing Kronos and begin archiving the old system. I'll turn it back to you, Aaron.
Yeah, thanks, Deb, for that really great update. Fantastic project underway. Very exciting to think about that moving ahead. And with that, another very exciting project underway in terms of our overall expansion of services underway at McMaster Children's Hospital. And to tell us about that, of course, is Bruce Squires, our president at McMaster Children's Hospital and VP of Women's and Children's Health. Bruce, over to you.
Thanks very much, Aaron, and good afternoon, everyone. I agree. I do think it is exciting, and this is my first opportunity to talk to all of HHS through a town hall about this significant corporate initiative. That's it's really seeing us grow the services that we provide at McMaster Children's Hospital, that in a way that's going to allow us to better meet the ongoing and growing patient needs for children, youth, families from across the entire region. Let's go to the next slide. Over the past few years in particular, we've really focused on trying to spread the word with the public and certainly with governments through media, through advocacy, that our children's hospital here in Hamilton was undersized relative to the needs of, again, a growing child and youth population in this region, and undersized relative to the 5 children's hospitals across Ontario. By most measures, we're the second largest children's hospital in the province, but we truly haven't been funded accordingly. And as a result of that, we've really been the most undersized. We've had the highest occupancy across the vast majority of our programs relative to other children's hospitals. And we do have the most significant wait lists across most of our programs, include, as an example, at right now, high 60%, so 68, 69% of our surgical patients have already passed the clinically recommended wait time for them to receive their care. Now, fortunately, as a result of that advocacy, and it really is a recognition of the work that all of our teams have done, that undersizing has started to be recognized. And so this summer, Premier Ford announced the single largest investment in children's healthcare across the province. And for us, while that's resulted in nearly 50 million, in fact, dollars of a new ongoing investment in our services. So we've created a corporate project with a tight but nonetheless significant structure to help us to put those into use. And of course, the biggest thing is to recruit a very significant number of new clinicians of all types, and at both the McMaster Children's Hospital and Medical Center site and at the Ron Joyce Children's Health Center. We're going to use that to support program expansion, but also there's pieces that are for new equipment and for other enhancements for what we do. As we are implementing those projects, of course, we also need to review what is across HHS a tight space environment, and look at innovative ways to facilitate the incoming people and the expanded patient care. And I really want to emphasize this last point. We're doing this work to get at the most significant gaps in care for the patients and families we all serve, and that really is a matter of health equity and health inequity. And we also know that we're not yet where we want to be in terms of EDI within the workforce of HHS. So we're certainly doing everything we can to integrate this project with the larger and significant EDI work that is happening in the EDI strategic plan for our entire organization. Let's go to the next slide. So a couple of examples here of some of the places where the new investments have already come into play and are making a difference. We've put in place a rapid assessment service within the emergency department, working 4 hours a day, sort of at that peak time, 4:30 to 8:30, accessible to families each day of the week, and that's really providing an opportunity to funnel or to triage our less acute patients into another area. In fact, it's into the fracture clinic after hours, where they can be seen more quickly. Of course, that helps to alleviate ED congestion in our acute and our ambulatory zones, and is an important tool as we address what certainly have been over the last year very high admit to no bed numbers, again much higher than the rest of the province. Since April, we've had in place the same day overnight unit, which is really providing an opportunity for post-surgical patients who do require observation to be seen, observed overnight in our perioperative space, to not have to take up a very scarce inpatient bed, and to be discharged early in the morning. We've added additional beds on 3Y as well as on 3C and 3Z. So that's both in our inpatient surgical and our inpatient pediatric medicine unit. And we've used the new funding we've received in the last year for pediatric level 2 ICU step-down beds to really create some appropriate permanent space at the back of 3Y for those level 2 patients, and that again is going to help us to facilitate our pediatric surgical scheduled care. We also have a Voygo truck available that's really helping us to ensure we can better optimize the use of capacity across the province. Those are just 4 of the more than 20 initiatives that are being facilitated by that funding I mentioned earlier. If we go to the next slide, I'll highlight one other, and this is the brand new extensive needs proof of concept program that was announced by the Minister of Health and the Minister of Children, Community and Social Services. You see them in the picture there when they were with us at the Brown Joyce Center in April. It's a first of a kind pilot program, $11 million a year to support tailored integrated care for children and for the families who have an extensive and intensive variety of needs associated with behavior, development, mental health, physical, social vulnerabilities. In the past, these are kids who have fallen through the cracks between with a system that has some of their needs meant to be met in health with its own mechanisms for triaging, et cetera, and its own funding environments, and some of their needs being met in the child and community social services system, again, with different mechanisms for assessment and for eligibility. And the result, as I said, is so many of these kids fell through the cracks with really terrible consequences for their family environments, for school attendance, for family breakdown, and for use of the child justice system, et cetera. And of course, they also often were forced to use hospital beds as really an only safe place for them, a version of ALC in the pediatric population. So in this case, our teams across our autism, our child development and rehab, our mental health, and some of our other programs have been coming together to create this wraparound service. This proof of concept is here at McMaster Children's, as well as at our counterparts at CHEO and Holland Bloorview. This is just one example, Aaron and folks, of one of the projects, one of the initiatives, one of the service enhancements that's made possible by the really extensive investment that has flowed to us at HHS and McMaster Children's Hospital this year. We're going to look for the opportunity in coming town halls to talk about some more of those initiatives. But for today, I'll leave it there. Thanks, Aaron.
Yeah, amazing. Thanks very much, Bruce. A really profound investment in Hamilton Health Sciences and McMaster Children's Hospital, and a vote of confidence in the work that we're doing by the government. So thank you for that update. Exciting for our community too. Okay, if we could move to the next slide. We have had our Q&A open today, and so we will, until the end of our session, that will be open, and you can pose questions there if they come to mind. And as always, if you forget to ask something today, but you want to after the fact, you can always do that at hhsnews@hhsc.ca, and we'll make sure that we get an answer to you as quickly as possible through that forum. Next slide, please. And so now we're at the part of our agenda where we get to celebrate the work that's underway, the people that are doing it, some of the accomplishments we've achieved together. So I would encourage our presenters as well as our participants. You can either type something in the chat forum and I'll read it out, or you can raise your hand and we'll call on you to give your shout out live. So I see Leslie Gillies with a hand up. Leslie, what would you like to celebrate today?
Thanks, Aaron. Of course, the final accreditation report has been recently posted and communication shared, but really wanted to recognize our HHS staff, physicians, managers, practice chiefs, educators, directors, and quality team leadership, of course, for everyone's efforts in the preparation and achievement of exemplary status in our accreditation designation. Fantastic work and really notable, many recommendations from the accreditation team for us to submit some leading best practices for Accreditation Canada. So kudos to everyone, and thank you again to Tim and Brian and Steve and Ron and all the quality team for their leader in this. Thanks.
Yeah, for sure. What an important celebration. Remarkable work across the entire organization for that achievement. Thanks, Leslie, for calling that out. I see Sarah Jane with a hand up. I have just, well, maybe Sarah Jane, you go ahead. Then I'm going to read two rather lengthy ones here in the comments. So that's great. But over to you. What would you like to celebrate today?
Thank you, Aaron. So next week, November 8th, marks 128 years since the discovery of what we know as X-ray. And with that, we celebrate our MRTs, our medical radiation technologists. They are in our departments, they're across all sites, they're in ED, they're in the EP labs, they're in the ORs, they're everywhere. HHS just couldn't function without you guys. So I wanted to reach out and say a really big thank you to all the MRTs across all our sites. You guys bring it every single day, and we are so, so proud of you. And I hope you really enjoy your MRT week next week.
Awesome. Thanks for that. And for the historical context, that's good stuff. Thanks, Sarah Jane. Okay, so I have two here. I don't know if they are visible to the entire viewing audience. It says hosts and panelists, but one from Diane Norman saying November 1st was Take Your Kid to Work Day, the first since the pandemic. And 95 students were hosted at the general site, and a variety of presenters highlighted career opportunities at Hamilton Health Sciences. Many thanks to the presenters, as well as the interprofessional development team, Kathleen Hudson, Nick Morrison, Aaron Stanley, and Michelle Molozzi, who planned and facilitated this event. And wow, thanks. And thanks to the parents that brought their kids to work today or yesterday too. Thank you very much. Thanks, Diane. I also have another one here from Neil Johnson. Thanks to everyone at Hamilton Health Sciences and our foundation who supported and organized the Hamilton Health Science Foundation's Illuminate event on October the 12th at Diamonds Farm. It was very successful. It was a great event with almost 600 people in attendance and raised over $200,000 in support of Juravinski Cancer Center's research program. Thanks so much, Neil, for pointing that out. And here I have another from Jennifer Lounsbury. October 27th, we reached a big milestone of 100,000 active HHS MyChart accounts. 100,000, that's incredible. Thanks for sharing that, Jennifer. Okay, Susan Fucciarelli with a hand up. Susan, what would you like to celebrate today?
Hi, thanks very much, Aaron. I just want to thank everybody for your participation in the Healthy Workplace Month. I think we had a really excellent array of activities and programs. So really glad that people were able to avail themselves of those opportunities. And I'd like to specifically just recognize and thank some key people who helped to coordinate and make sure that everything went smoothly. So that would be Melissa Cummings, Natalie Plazzini, Erica Casperson, and Veronica McGee. So thank you so much for that. And if I could just take one more moment here just to promote another partnership that we have with the YMCA that is coming your way. It's the Back to Living Well program. It will be for individuals who are suffering from chronic low back pain. It's a fitness regime program that is 12 weeks in length. It is limited to 50 participants. It's virtual, so it's available to all of our staff, physicians, residents across the organization. And there'll be more information to come on that on the Hub next week. So please look for that. Thank you.
Awesome. Thanks, Susan. Double shout out. I see too in our Q&A, a shout out from Kristen Loschiavo. A big shout out to all the teams at McMaster Children's Hospital who threw an amazing Halloween parade. It was heartwarming to see the dedication and effort put in by the teams at MCH to organize a Halloween parade for patients and families. The event brought joy to families who were going through a tough time, and the wonderful staff went above and beyond to make sure the kids had a memorable day. Kudos to everyone involved for a job well done. and as well a prompt from Yelena Potts celebrating that as well. So wonderful work on that. And of course, you can always look on social media and see lots of pictures of that action taking place. That's great. Susan, I think that's probably an old hand there. Bruce, I see you have a hand up. Let's go to you next. What would you like to shout out today?
Oh, thanks very much, Aaron. It's actually about Susan and her team. So just reminded by Dominic's presentation and by my most recent experience that the EHS team across all our sites, as well as the pharmacy team, doing such an amazing job and delivering in a painless way. Our at least from my experience, painless, our COVID and our flu vaccine. So just want to celebrate that and encourage everyone. Go ahead and take advantage of that. And you know, if you're like me and you need a little bit of kind of support while you're doing that, just grab one of your stuffies and they can keep you comfortable.
Looks like you got a few there, Bruce. So good for you. I'm going to assume we might be having technical difficulty with our chat because I noticed that many of our panelists are using the Q&A. I'm going to adapt on the fly and go into the Q&A and read some of these shout outs that are coming through. One from Robin Luting, the incredible Child Life team at McMaster for an incredible Halloween parade. Another shout out for that. That's great. From an anonymous attendee, can't join as a panelist. Can you please thank all our teams working to provide vaccines to our patients, staff, and physicians, our pharmacy and employee health teams? For sure. Thank you, anonymous attendee. From Morgan Richardson, recognizing the tremendous effort of our wellness coordinators, Melissa and Natalie, who work tirelessly to meet the needs of our staff, also applauding their intentional efforts to collaborate with other departments, pet therapy being one. Thanks so much, Morgan. Oh, anonymous attendee, the above is from Les Coche. Okay, perfect. From Naham Azam, a shout outs to the Boris Clinic and CRS staff at Ron Joyce Children's Health Center for their dedication to the care data pilot and working towards health equity for our patients. Thanks, Naham. And someone as well. Yes, okay, the chat is disabled. So my apologies to our viewing audience today, but thank you for nonetheless switching and jumping on in the Q&A. It's proof that we have too many celebrations to be held back by technology. Maybe as a closing celebration, I will celebrate the ongoing work and the response rate for our My Voice Matters survey, which is out and available for all of you to fill out right now. Our response rate has been very strong, and want to thank those that have participated and remind those that haven't yet to please do so, because if not you, then who? Okay, we'll leave it there. And Sharon, I'll pass it over to you for closing remarks and see everyone next time.
Great. Thanks, Aaron. And thanks, everybody. There were some wonderful celebrations today. And I'm sure many more that we just didn't hear today, but we'll hear next time. So thanks, everyone, for joining. We know you're all incredibly busy, so we appreciate the time that you take when the challenges are so deep. And we all recognize the amazing work that's being done across HHS. So thanks very much. Have a good day.